Yes, hello. My name is Aaron Nangle from waiverprovider.com. Here with me today is Secretary Holly Benson from AHCA, and she has some valuable information to share with us. So please listen to each and every video that you see in front of you. And hi, Holly. How are you today?
I'm great. How about you?
Good. To start, can you tell everybody a little bit about yourself, your background, what you do here at AHCA?
Sure. My name is Holly Benson. I'm the Secretary of the Agency for Healthcare Administration. I have served in this position for just over 10 months now. I joined the CHRIST administration 2 years ago and first served as Secretary of the Department of Business and Professional Regulation. Before that, I served as a state representative from District 3, which is primarily Pensacola and also in the city of Gulf Breeze.
Okay. And I see that there are new health care plans that Governor Charlie Crist helped put together for uninsured Floridians. Can you tell my readers about the new Cover Florida Health Care Access Program, and that will be available on January 5th, which I guess it's available now, and how it can help them and their families?
Yeah, we are really excited about this. Usually it takes governors a long time to figure out how important healthcare is, but this governor, I think you know that he has his ear to the pulse of the state, and he found that there are a lot of people who are worried about finding affordable health insurance. We have about 3.6 million uninsured Floridians, and so last year, on the opening day of session, Governor Crist put this at the top of his agenda, and so we created something called Cover Florida, and what it is it's a low-cost health insurance product, and your readers can hear more about it at coverfloridahealthcare.com, coverfloridahealthcare.com. And so what is being now offered by these insurance providers is there are preventive plans, which have a low price, many average around $55, and then there are ones that have preventive and catastrophic coverage that average around $155 a month. They cover basic services, basic screenings, and things like that, but we hope it'll make a meaningful difference for those families who are looking for affordable coverage.
Good. And how does someone decide what plan to use?
Well, we wanted to make sure that the information on our website was useful. So if you go to the Cover Florida Healthcare, sorry, well, I just have to make sure you get it right because it's easy to get misdirected with search engines. If you go to coverfloridahealthcare.com, it has a comparison chart that shows you what each of the plans will offer and what they cover and what your deductibles and copays will be.
Good, good. And what exactly does it cover?
Well, as I said, it does vary by plan, but most of the plans cover your basic preventive services like your annual checkups, a couple of other doctor's visits. They do your screenings, breast mammograms, colon cancer screenings, those kinds of things. And then the ones with the catastrophic also cover a couple of days of inpatient stay in the hospital. And
does it cover pre-existing conditions?
No. So, as with most insurance coverage, a pre-existing condition has to be excluded from coverage for about a year from the date that you got that information.
Okay. And how much does it cost for people to join?
Well, we found that the average for the combined preventive and catastrophic plan is about $155 a month.
Okay. Now, I read an article in regards to Florida saving $3.97 million by merging the Agency for Healthcare Administration with the Department of Health. What are your thoughts on this, and do you think this merge will take place?
I think that's an idea that has been discussed for several years, and the legislature is looking seriously at it. The governor's office is looking seriously at it. In these times when everybody's budgets are strapped, even $3.97 million makes a difference. And what we try to measure at this agency is not just what are the impact to taxpayers' dollars that are being spent at our agency, but what are the overall costs to the system? Because you have to measure more broadly. So if there are ways that by coordinating our services through the Department of Health and our agency better, that we can reduce those costs, like if you don't have to have quite so many licenses or inspections, or if we combine our preventive care with the back-end Medicaid services better, well, that makes a difference for every Floridian, whether they're receiving care from us or whether they're a taxpayer.
Right, sure. If you could just try and speak a little louder.
Oh, louder, sorry. Yeah.
It's okay. Now, I see that one of AHCA's goals this year is to make information about the care people receive more useful to them, and that the Center for Health Information and Policy Analysis has created a new website, floridahealthcarefinder.gov, to help. Can you tell me more about the website and what it has to offer to people of Florida?
Yeah, actually, the Florida Center is one of our best kept secrets at AHCA, and we have that website, floridahealthfinder.com or .gov, or however you might like to find it. And it's really useful because what it shows you is different information about your health plans across the state. It tells you about the satisfaction that people have with the services that they're getting. It tells you what they cover and things like that. In addition, we now give you information on price and outcomes for 150 different procedures because we think that when you go to the doctor's office, you should have more information about the health care you're buying. So this is a really valuable tool for consumers across the state.
So that would be a good website for people to make sure they look over.
Yes.
Now, what about Kid Care? Is that part of AHCA? Who qualifies for that?
Kid Care is actually a separate entity. So in the way that healthcare agencies work in the state, there are substantial proportions of state dollars that pass through us and go to our sister healthcare agencies. Kid Care is run separately, and so we run the money to them. Kid Care is a program that, if you were in 1989, but I was graduating from high school in 1989, and I remember how Stone Age those computers were.
Oh,
right?
yeah.
And so we really, in order to make sure we got providers paid timely, needed to upgrade the system because the old system just wasn't working anymore. Unfortunately, when you have that many people you have to pay and that many bills, there are bound to be glitches. And so what my understanding is from talking to my peers across the country is ours has gone pretty well. I mean, there are states that have had to ignore the computer system altogether and handwrite every single check, which is pretty pitiful, right?
It'd be time consuming.
Now, having said all that, it doesn't make any of your audience feel any better because getting paid is important to them.
Right.
It's also very important to us. But our fiscal agent, that's what we call the people who pay the bills, they're very eager to make sure we get this just right. And so you can either call those field offices or you may call EDS directly at 1-800-289-7799. If that doesn't work, you can send me an email,
Okay.
and we'll start getting it routed through. Rather than tell you my whole long email address, if you go to our website, you can see an email to the secretary function.
It's right on the front page.
Yeah, and so they can email me, and we will get it routed to get it taken care of. Okay.
Now, a little on the same topic, real quick. Let me just give you an example.
Okay.
Say you have a caseworker, a support coordinator, or a provider, for that matter, and say when they did the emergency payments to everybody, they're not a provider or a support coordinator anymore, but yet they got an emergency payment. Say, for example, $19,000, right? But they're no longer working for that system, for that group, right? Now, I know several people that's happened to, and they're like, well, I guess that's free money. But we know that that's not the case, but, how are they, if they're not billing anymore, you can't take it back from their billing, how are they supposed to pay it back? Because I know a couple of them that have called, and they straight out told them, well, as soon as you bill. Well, I'm not billing anymore, but we'll get back to you. And that's been weeks, and they haven't got back to them.
Okay.
And, and I know one person that's got all this money in their account, and they're like, well, I want to give this back because I know sooner or later I'm going to be accountable.
Well, thank you. Please tell them thank you for wanting to give the money back. Again, if you want to give me some specifics after we finish this interview, let's do that. And if you'd rather just email me those specifics, then we will address that. And it's nice that they're worried about that. I think everybody knows, particularly in these days, every dollar is precious, and we want to make sure that they go to the services that everyone needs. So,
exactly.
So thank you. Yeah, we work really hard to get people paid timely. Now I guess we're giving